Welcome to Munroe Regional Medical Center's nationally recognized and awarded Munroe Heart Program, and to our series of introduction videos. This particular video will walk you through the experience of a Munroe Heart cardiac cath patient. From all of our Munroe Heart team, thank you for watching this video on cardiac cath care.
If you are an outpatient, you will be advised by your primary care doctor or cardiologist that you need to have a cardiac cath. Once our heart program receives your referral, our office staff will call you personally to set up a procedure date and arrival time and give you further patient instructions regarding your procedure. You will then come in at your arrival time to express admissions located in the Johnson lobby on the second floor with a completed basic patient history form. Following this, you'll be taken to our 22-bed cath lab admissions unit. If you are an inpatient, one of our interventional cardiologists will meet with you personally and assess you, collaborate with cath lab admissions unit staff, and one of our floor nurses will complete all necessary paperwork. Cath lab's admission unit staff will then transport you to their unit. Once in the cath lab's admission unit, you will receive a comprehensive workup, which includes obtaining your vitals, assessing your pulses, and discussing your medical and surgical history. A list of current medications will be obtained, 2 IVs will be started, electrocardiogram patches will be applied and monitored, and further physician assessments and orders will be performed. Lastly, consent forms are signed, pre-medications for your procedure are given to you as ordered by your physician, and then you will be prepped and ready for your procedure. Once ready, a member of our cath lab staff will transport you by stretcher to one of our procedure rooms. Munroe Heart has 4 cath lab rooms and 1 electrophysiology room. Your cath lab care team will include a combination of registered nurses and cardiovascular technologists, as well as the interventional cardiologist, the physician who will perform your procedure. This team will connect your monitoring equipment, apply oxygen, prepare your access site, and give you necessary medications. Once prepped, the staff will place a sterile drape for the procedure over you and prepare the supplies needed for the procedure. When everything is in place to begin your procedure, your interventional cardiologist is called to the room. Your care team will put on lead aprons, and you will be given medications for moderate sedation. The physician numbs your access site with lidocaine and inserts a sheath into the chosen artery or vein. Once the physician has access, and if your family has opted to watch your procedure, a care team member escorts your family into the viewing room. Munroe Heart prides itself on sharing this experience with family members. Very few hospitals have this level of family engagement. However, families are not permitted to watch in an emergent situation.
If the physician does not see need for an intervention, your procedure is complete. All catheters and wires are removed, and the procedure room staff will explain the process of removing the access sheath. This requires a staff person to apply pressure to your access site. Once they have controlled and stopped the bleeding, a small gauze dressing will be applied to the site. You then will be returned to a stretcher and taken back to the cath lab admissions unit or cardiac floor bed, where you will be required to lay flat for several hours. Now, if the physician determines that there needs to be an intervention, he will address the area of concern with catheters, wires, balloons, and stents. At this time, you will be given blood thinners to prevent blood clots from forming during the procedure. After the procedure is complete, the physician may use a stitch or device to close the hole in your artery. Sometimes the access sheath may need to remain in place until the effects of the blood thinners wear off. Once this happens, a staff person will remove the sheath and apply pressure to the site for several minutes until it is no longer bleeding. Again, in this case too, you will be required to lay flat for several hours. Some patients go home several hours after their procedure, and some patients stay overnight for closer monitoring. If you've had other medical problems in addition to needing a heart cath, your hospital length of stay will be determined by your admitting physician. If you've had a stent placed, you may need to take oral blood thinners or medications for a period of time to be determined by the physician. The nursing staff will provide discharge instructions about medications, site care, activity limitations, diet, and when you may need to seek emergent care before you go home.
Have you ever heard of an ST elevation myocardial infarction, or STEMI for short? Well, a STEMI is a very serious type of heart attack during which one of the heart's major arteries, one of the arteries that supplies oxygen and nutrient-rich blood to the heart muscle itself, is blocked. During an acute STEMI, seconds count. If a patient is outside the facility having chest pain or cardiac symptoms, the patient will have an electrocardiogram obtained by emergency medical services personnel. The EMS personnel will transmit en route to the hospital the readings to Munroe's emergency department physician and/or our interventional cardiologist. One of those physicians determines whether the patient is having a STEMI and will call a STEMI alert. When this happens, as soon as the patient arrives in the emergency department, our emergency department team immediately begins to prepare the patient for the cath lab. The cath lab staff come to the emergency department with the interventional cardiologist and transport the patient directly to the cath lab for their procedure.